All right, I'll just start the recording and I'll get screen up.
Okay, so slides up.
Just bringing my slides up now. Can everyone see my screen?
Yes.
Fantastic. Well, welcome everybody. I'm so happy to be here, and thanks, Aaron, for having me on. This is a privilege to be able to give this presentation to counsellors. So basically, I started the Australian Sound Healers. My name's Leith. I started the Australian Sound Healers Association. It was basically a heart-based project that I saw that people were challenged, people were suffering from mental health, and I could see that escalating post-COVID, and we needed some more people out there to help more people. And I play gongs myself, and I noticed that when I ran group sessions, I could sometimes have 50, 100, 200 people in one room and see massive results from those sessions. And so I decided to start something that was it was basically an area that wasn't recognised, and since we were able to start to see sound through cymatics, people were starting to uh, understand a little bit more about sound and the impact that had on people. So yeah, I started the Australian Sound Healers Association as to create a benchmark for sound healing and sound therapy, and we've come a long way since that was 4 years ago, and we've created an amazing course, and we have a we have a members section and a directory, so we have a pathway there for practitioners. And and it was important to create something that was trauma informed and for mental health in particular, and that was grounded in science and sort of more of a practical approach to the training. So this is an introductory session for the Australian counsellors members, and on sound therapy and the nervous system regulation. And it's an ethical integration within the scope of practice. And so I've brought in my so the Australian Sound Healers Association is a professional body for sound therapy education practitioners, standards and community. Our mission is to support mental health and wellbeing through trauma-informed sound therapy, through education, a practitioner network, a public directory, and a pathway into mainstream wellbeing settings. The aim today is to give you a clear, honest picture of what sound therapy is, what the evidence does and doesn't say, and how it can sit safely alongside your counselling practice. So what we offer is trauma-informed training, professional standards and ethics, practitioner directory, insurance pathway for members, and a national community. So what sound therapy is and what it isn't. So sound therapy is a practice using instruments and voice to support relaxation and nervous system regulation, a supportive non-verbal experience that sits alongside the work you already do, grounded in both lived experience and a growing evidence base, delivered one-on-one or in groups. And what sound therapy isn't is a medical treatment, diagnosis, a cure, a replacement for counselling, therapy, or clinical care. And it's not a claim to fix or heal a condition, and or practiced outside the practitioner's scope of training. So we can't diagnose, and we can't prescribe, I think is one of the other words. And I'd like to introduce my beautiful teacher, Becc, who has helped us run a couple of sessions, and she will talk to you about her experience of how she got into this area, and I'll hand it over to Becc. Thank you.
Well, thank you, Leith. Nice to meet you all, and yeah, really great to be here. I studied music, and that was the beginning, but it was after a long, long period of time abroad. I came back. I came back to Australia after being in London for 10 years and was quite unwell myself, and underwent a huge amount of clinical treatment for a number of years, maybe 6 years of therapy. And when I say therapy, I mean counsellors, psychotherapists, psychiatrists. I was in many rehabs, and I was diagnosed with many different things. And I absolutely improved. There's no question about that. But I was still continually struggling to a point where it was really quite dangerous. And I kind of had to surrender to a space that felt very different and uncomfortable for me, and I didn't want to. But a part of me knew that there was a kind of a part of me that wasn't being tended to. So, cut a really long story short, I entered a more of a holistic world, and I did a lot of training, and I've done a lot of training in a lot of different things. Whether it be holistic or, I also did a diploma in community services. So working with people with disability, mental health, drug and alcohol. I worked at Sydney's longest running women's refuge, Lou's Place, for a year, offering sound. And I also worked at South Pacific Private, which is a private rehab based here in Sydney. People go there for various different maladies, whether it be drug and alcohol addiction, whether it be mental health, anything of the sort. Anyway, over the years, I've learnt and worked with sound, but particularly one-on-one. And I've used all of the various trainings that I've had, whether it be music and whether it also be trauma-informed care, to treat and work with people. It's helped me tremendously. It's changed my life. It absolutely has, but so has the clinical component of my own personal journey, and those two can coexist together. But it wasn't until they began to coexist together that I saw real transformation in my ability to live in the world. And so I use it today to help others. I have this space here, and I treat from here, and I have people who come to me with various conditions, mostly trauma. I have a lot of people who come to me with, quite severe ADHD, autism, depression, anxiety, drug and alcohol addiction, all the way to cancer, all the way to people just needing some support in their lives and feeling a sense of something missing. And so I'm very, very, very happy and very honoured to be here chatting with you all and taking a practical look at how sound can support regulation and co-regulation, and how to hold a safe space in a trauma-informed way within your existing professional scope. So How does sound support the nervous system? Well, it absolutely does, and evidence shows that it automatically reacts and responds to the autonomic nervous system. So sound and rhythm can actually help shift the body from a stress sympathetic state to a rest and regulate state. Entrainment, so that's the tendency of the body's rhythms to synchronize with a steady external rhythm. So a foundation of how sound can settle the system. So if you think about it, and quite a lot of people do, like if you're in an environment where there's a lot of frenetic energy, there's a lot of loud noise, then typically one feels the same. And the same applies with entrainment. And co-regulation, so a grounded, present facilitator really helps a client's nervous system settle. I'm sure you guys already know this. So the same kind of relational principle counsellors already work with, you guys know that. So being able to regulate yourself makes a huge difference to how the interaction with the client takes place. And then, of course, safety is the first thing, especially in the one-on-one work. So regulation only happens when a person feels safe. So creating a safe environment with a steady, slow pace and consent before anything is done or used. So environment is super important. And I've found, for me, having been in many different, I guess, healing and clinical spaces, you know, my ability to receive the treatment has been heavily influenced by the environment. So having an exclusive space where it feels easy to come in and out. There's predictability, of course. There's this feeling of safety, consent and pace. So like informed consent is so important. So when a client is allowing them, educating them on what they're about to experience and knowing that they can at any moment feel like they can opt out, you know, and nothing takes place without permission. And typically in a trauma-informed space, we move, and typically in most situations, we move slow and we move steady. And sound can sometimes do the opposite. So talking about that, but presence, so the tone and the pace and the posture and stillness. So being grounded yourself before holding space for others is key. And again, many of these things you probably already know, but when we're thinking about it within the scope of sound, it's just applying it in that way. So repair, which is kind of recognizing distress, because sound can often cause distress as well when it's not used responsibly or with knowledge. So, and being able to respond without it escalating, and being able to close and ground. So there being a process to that experience. The scope, so knowing the edges of sound therapy as well, and referring on when something sits outside of that. So I'll give an example. I have many clients who come to me regularly, and they also have additional, and I'll make sure that if they're coming with some really serious stuff, that there's clinical support around that to support whatever it is that I'm offering as well. And integration, how sound can sit alongside. It never replaces the counselling relationship, but it can be an incredibly powerful tool to assist both the connection between you and your client, but also the place in which they can go to and the somatic space in which they can experience that healing effect and that therapy. So I'm rambling, but we'll keep going. So many clients arrive carrying stress. I mean, so many of us carry stress, but words kind of sometimes you're all talked out, you know. And I think we all know this is this. So sound offers a non-verbal way for a person to settle in the body, so that the work can actually land, you know, so that the words perhaps sit more clearly with clarity in a deeper, more present way. You're already skilled in presence, attunement, and co-regulation. So sound therapy just builds on those exact strengths. It supports it rather than asking you to learn something foreign. And so used within scope, it becomes one more kind of grounded, trauma-aware tool, not a replacement for the therapeutic relationship at the center of your practice, but something that can absolutely amplify your relationship and that person's experience in their healing process. I should also add that I'm currently doing, which might be familiar to you all, the somatic experiencing training, the Peter Levine Restoring Resilience training in somatic therapy, because I have so many clients come to me with so much trauma, so much stuff. So yeah. And so there are lots of different instruments, and Aaron, you brought out, the singing bowl and the tuning forks, but actually understanding that each instrument does something incredibly different, and that type of instrument is going to have a completely different impact and effect, particularly the way that you use it. So just going through a few of these kind of key instruments. So singing bowls, which are like particularly like a really safe place for someone to go, and quite often like the best route, because they offer like a sustained, soft, warm, steadying tone. That's quite settling. Obviously, it depends on the bowl in which you're using, and that's a whole other story. Gongs, so they're rich, they're complex, they're in harmonic tones. So they have the ability to release deeply, but particular care needs to be used with gongs. And I've had a lot of students who will just strike a gong and it can really trigger a huge trauma response. But when used softly, it can be deeply grounding. Tuning forks. So tuning forks are amazing. And I had my doctor use a tuning fork on me the other day because I lost the hearing on one side of my ear. Well, that was interesting, considering that I have tuning forks here and use them for my body work. But they tend to be more focused on precise frequencies. They're calming, they're clarifying. They're a little more subtle, but are often used for body work. So acupuncture, at acupressure points along the body. Drums and percussion, I guess, again, there are more, is this kind of a bit of cultural appropriation and understanding that typically percussion has been used in ritual for stimulating or guiding experience as more of a sound journey. It can be used in sound healing, but the place that it will generally take someone to is a little more stirring. And so, as with the voice, toning or chanting, again, can be really beautiful, but it can also unsteady some people. It is, generally speaking, rooted in ritual and spiritual practice. So I would recommend it being used sparingly. And chimes and other instruments, I have a lot of little delicate Burma bells and handheld bowls, and typically they're quite light. And so when things feel heavy, they create a lot of spaciousness and they lift the energy and add balance. So if you're using lower tones, to be able to balance them with higher tones. And they create a really beautiful, open, soft space. Okay. I'm talking. Sound therapy complements counselling. There's no question about it. It does not replace the therapeutic relationship or clinical judgment. So stay within your training scope and use sound for regulation and grounding, but not as clinical intervention. It actually really does require training. And I'm very grateful for the training that I've had over the many years. It's helped me to understand how to use sound in a way that can actually alter a situation. Always maintain informed consent, confidentiality, clear boundaries, all the same things that you would apply in your practice, as you would with sound. You would apply that exactly the same with sound, and refer on when it sits outside sound therapy. So knowing the edges, is a part of the safe practice, and proper training and insurance really matters before offering sound therapy to clients. So before, I've had a lot of people, and you see it everywhere, people just putting bowls on people and really, really not knowing what they're doing. And I'll give a perfect example is one of my clients. She comes to me weekly. She's in recovery from drug and alcohol addiction, but also was severely traumatized. She's gone to several different rehabs, and this seems to be the only spaces she feels safe. And so her and I treat her weekly, and we have a whole process to the practice. So we start by doing an inventory. She'll write a list of things she's proud of. She's also, she's been diagnosed with many, many different things and has a counsellor, has a HT person with her once a week. She's got a lot of clinicians at the moment. She's in early stages of recovery, but this seems to be the one place where something happens. So she'll come to me before we'll do this. We'll integrate this into our sessions where she'll write 3 things she's proud of, 3 things that maybe she could improve on, and 3 things that are true to her. We proceed with the session. And each time I'll ask her again, are you okay? Do you want to start with the physical body work and so forth? And at the end, we then step into a half an hour, 45 minutes of a somatic practice. So whether it be something creative, so that there can be an expression of her experience without needing words. If she wants to speak about it, we do speak. And she's also got her therapist the day after, and that's fine. But I'll give her activities. So whether it be crafting, making things, anything where she can use her body, listen or draw or collage. And last week I got her to go out into nature, collect 3 pieces of items of nature, one that represented her past, one that represented her present, and one that represented her future. So just as more of a different way of looking at where she's at.
That's great, Becc. Thank you for that presentation.
I have countless other stories, but for the moment, that's kind of what I can share within the time limit. So yeah, I don't know if anyone has any questions. So
Yeah. Well, I just want to talk about this part now, and obviously stories and lived experience is really important in our practice, and especially with the teachers. And now mental health is talking a lot about lived experience and how important it is to have gone through these challenges that we go through in life. So the sound therapy advanced practitioner training is for those who want to practice sound therapy, properly trauma informed, and learning from more wisdom that Becc has, science aware and grounded in clear professional standards. Exclusive to the Australian Counselling chapter, we've got a 15% off for counsellors to run through the training, and so if you're interested in that, please check out our website. And now I wanted to open up some discussion, maybe some questions you may have about sound, and maybe we can play some instruments as well, or tap some singing bowls just to, or strike some singing bowls just to hear the sounds of them, and maybe even explore what that brings up for you in the session.
I would love to hear if anyone has been using sound in their practice, and if they're intending on, and how you found that experience for yourself as well.
I can probably kick off briefly. I'm not exactly trained specifically in sound or whatnot, but I think I'm probably what you'd call like an auditory person, like an auditory processor. And so I find that sound is really important to me. So I often will just have my bowl or my tuning fork on the table, and I won't necessarily like bring that up, but oftentimes I'll find the people that are curious, they'll want to start interacting with them, and then I'll just kind of give them show them how it works or give them a little interaction with it, and you'll find out the people who I guess I think are probably the auditory processors, they'll often just start engaging with that kind of stuff, and they'll start having their own kind of little shifts there. So I guess my use isn't particularly structured. It's more, I guess, just allowing people to kind of experiment with that in the space.
That's so cool, Aaron. I love that. Yeah.
So, yeah, anyone else? What about Julie?
No.
Come on, guys.
Has anyone been to a sound bath before, or a sound session where they've laid down on the floor and experienced the singing bowls or gongs?
Yeah, I have quite a few times.
There's quite a few in Newcastle.
Mm.
Yeah.
Yeah, I go up there quite often. My sister lives up there, and I know of a few practitioners who are up there. So yeah, I assuming that's where you're all based.
Yeah.
Yeah.
Mm.
Yeah. I don't know if there's any one-on-one practitioners though, and I don't know if there's people that are actually bringing it into a one-on-one setting or a holistic kind of therapeutic setting.
I'm curious. I've heard about sound healing or sound bathing for young people who've got ADHD. Is there some research about that?
Yes.
Yeah.
Yeah, there is. I mean, I guess between Leith and myself, we could probably provide links to clinical research, but there definitely is, and particularly ADHD, because if you think about like meditation being so challenging for people who have ADHD, and what's wonderful about sound is it can be a really strong anchor to focus your attention on, because it's stimulating but in a really soothing way, and it's interacting with your brain waves on the left and right hemispheres of the brain. So it really helps, and I have a lot of people with ADHD come to me. So there is and there's continued research. It's one of those areas at the moment where it's just like it's every day there's something new coming out, and so there's a lot of, and I have a collection of a lot of different medical research papers, but getting that to the stage where it can be I
Recognized.
guess it's a slow process. It's the same with yoga therapy, is and breath work, and understanding that actually a lot of these things they work, but we live in a system that requires so many processes of bureaucracy and compliance to get through. Yeah.
Yeah, it definitely gives something to the brain to grab onto. The sound is what takes you into the meditation. So that's why it's really great to apply sound for people with ADHD, as it gives them something to grab onto. So the sound can take them into the meditative state. But we've got a research pack that I've put together that's peer reviewed. And there's ongoing research, but there's a lot of research out there, and it's really challenging to get that into an acceptable area where it's taken on in professional areas.
So in different parts of the world, it's being used though, in neonatal units all across Europe, in other parts of the world, sound is being integrated much more into a clinical experience. So I think Australia might take a little bit of time to kind of get its head around it.
In the training that we have, we've aligned with the Medical Sound Association, and they're made up of doctors and sound therapists, and we run treatment plans that are based on their findings and their research. So we align with that, and we're constantly, we'd love to conduct a lot of our research ourselves. I've done a bit of live blood analysis research where I've taken 6 subjects and taken their bloods and looked under a microscope and looked at their cells and then applied sound for 20 minutes, the gongs, and then tested the bloods again, and then noticed that it reduces inflammation in the cells, creates more hydration in the cells, and that video alone has gone to hundreds of thousands of people around the world. Obviously it's not peer reviewed and with 50, 100, 200 people, but it's just something that I wanted to see myself and to see the results of what I was doing and the impact that it was having on the bloods. I can send that research through to you. That video is really helpful there. But yeah, obviously it's ongoing, and funding is a huge one to be able to start that research. A lot of the case studies that the students are doing is going to for us to collect data. We're creating a database, so we can have that sort of information that will help us to go on those research paths.
Are you guys using any kind of EMDR therapy in your work?
Yeah, we've got multiple. Eye movement integration therapy and EMDR practitioners here. Yep.
So EMDR's kind of closely sound can be used in a much of a similar way. If you think about bilateral stimulation, so that stimulation through the left and right hemisphere of the brain, which is typically what I'll do in a one-on-one session, is have the frequencies moving on either side of the head, so that the left and right hemisphere begin to kind of interact and begin to process. So just thought I'd drop that in there because that is a really clear example of how you can actively, scientifically use sound as a form of EMDR therapy.
And that's the binaural beats that you apply there.
Yeah, depending on the frequency, you can, if you have two sounds coming from either side of the head, they can quite often create their own binaural beat. So there's lots of different recordings that are actually very difficult to find because there's so much nonsense out there. But you can find just pure binaural beats that are often almost inaudible that you can play in the background, and they automatically people drop, so that can be really powerful even in the background as a in your kind of clinical or therapeutic practice, is to have that binaural beat, because it is, again, it's almost inaudible, but it activates. Yeah.
Can I ask a question? Well, that's just a bit more information. If you can hear me.
Yes.
Cool. So I just really like what you said about it creating balance. So when somebody's pitch is higher, and I'm just wondering what you actually do in that moment, what brings that balance? Tangible example, I guess.
So yeah, training, right? So like I have instruments here. I have lots of different types of bowls, and the different types of bowls will be different in pitch, in frequency. So I have countless instruments and bowls, and in my collection, I don't know if you can see, but I have a set of my own, and I know when someone comes to me, for example, whether it be a class, and I know that if they're it's all about balance is the key. Before you do anything, it's about balance. So if we're regulating up here, then the rest of the body will respond. And so I know that if I have a certain type of bowl that is in a certain octave, that's slower and softer and moves with the one next to it, that's where I'm going to put someone if I'm in a group situation when they're feeling frazzled. So that really comes with learning about this stuff, because it's not just I bought a bowl and then I played it, and then it's actually so much more complex. So because I'm musically trained as well, and because I've been doing this for such a long time, I know which bowls to use, and of course that training really helped me. But but having the right pitch and balancing that, because you could play beautiful, warm sounds for days and people will love it, but they'll fall asleep or they'll clock out. So how can you keep someone in a maybe a theta brainwave state where they're able to process, they're kind of still there, but so it's actually quite a complex practice. And if I've got people who are really sinking low, then I'll bring in very gentle chimes and bells that will help to lift and lighten, especially when I have a group on a Sunday night here at 7:30 p.m. I mean, get ready, get the snorers out, But I mean, of course, it's natural, and actually, it's my teacher said to me, Becc, it's a compliment that they feel safe enough in your environment to fall asleep. And then you think, my God, But so I typically on a Sunday night will have a lot of chimes and higher pitched rimming bowls. But it is something that like that I had to be taught and learn over a long period of time. As a clinical practitioner, your best bet is starting with a couple of bowls, and you'd really need a bit of education on what bowls, because it's not just a singing bowl. There are hundreds of types of singing bowls, and quite often you'll get ripped off and you won't know what you're getting. So it's important to understand, this is a Jambati bowl. This has this kind of impact. The thicker the bowl or the thinner the bowl, like I could talk for days about it, but the thicker the bowl, the higher the pitch, the thinner the bowl, the greater the vibration and more textural and warm, but the sound will move a lot. It will move a lot more, so you won't get a definite note. It's a lot.
Yeah, thank you for that.
Yeah.
But balance is key for sure.
Very interesting.
Yeah. Yeah, I think it's interesting. Well, I've actively seen it help people, and I've actively had people on the mat who have either been shaking, crying, laughing. I have a bucket here because I have one client who on occasion vomits, quite intense responses. So managing that, is a responsibility. And I've had to get the right training around it over the years to make sure that I know how to keep people safe. And some people will come and they'll just be very relaxed, which is also wonderful.
I think
Can I just
you-
ask something? Yeah, sorry. You said that there's some great just background instruments that you could just use while you're doing a session.
Yes.
Would you be able to send us some links of some really good ones so that we're not just
So I was referring to binaural beats, which aren't really, they're almost that you're talking about the sounds that I said that were inaudible.
Yeah.
Almost inaudible. Yeah, I'll speak to Leith and
Yeah.
yeah.
Wonderful.
Yeah.
Thank you.
Yeah, any stuff, just send to me, guys, and I'll distribute.
yeah.
Oh, really? Will you put it in to share out to all?
Anything they send to me, I'll pass on to the ACA to send through.
I also think sound can actually really make a huge difference. And so if it's something that for anyone there here today that they kind of that they think could really be a part of their practice, like it's a really, really good time to be stepping into this area of work, because I can tell you right now, my classes are consistently fully booked with wait lists. I've had to clear my entire schedule because I can't take bookings at the moment. There needs to be more people doing this. I can't do it all on my own. I've had to actually turn a lot of people away, which is why I mean, it's been quite amazing to see the unfolding of and the demand, and realizing I can't. I simply can't look after 1,000 people. But there's need for education around it, and there's a need for people to use it. You can just see it popping up everywhere, and popping up in ways that are really like in ways where people don't actually understand. So I think it's amazing what ASHA is doing is creating some kind of space where there can be a benchmark or a glossary of terms where people can say, I'm providing sound, in this capacity, because it's a bit of the Wild West, and I think there needs to be some kind of knowledge. Yeah.
Guidelines with like
Yes.
It really does give people a safe space to open up and to explore areas that they would never have known possible, that they wouldn't be able to actually, speak about as well. And I think, if you apply sound at the start and then maybe a counselling session after to explore their experiences, you know, a lot of them don't even know that what's going on, until they're able to actually deeply relax into these altered
Yes.
states of consciousness and to really unpack, things that they never even knew that was there. And I think that's what sound really does. It really unpacks these areas, that they, in their subconscious minds that, I mean, they've come up. That I've had countless. I mean, I've done over 1,000 sound baths, and I've travelled and toured and played all over Australia, and the amount of information that comes after a session that they unpack. I mean, people say that, I went back to my childhood and this came up for me, or pregnant ladies have said, I've been able to, connect with my child for the first time, or someone has come to me and said, my partner that died 2 years ago is suddenly, I felt them leave, for the first time. And, I'm able to actually let go of them. The amount of people that come up with all these amazing things, and a lot of them don't tell me about this, and for 10 years later, like I bump into someone and they're like, do you know what that sound did to me? Like it changed my life. And I've just never ever caught up with them for them to actually say that. But I mean, I discovered it when I learnt the didgeridoo, and I was teaching didgeridoo, and I was exploring self-development. I learnt hypnosis and NLP and some advanced techniques in personal development. And I was teaching actually men how to circular breathe with the didgeridoo. And what was interesting that came up was they'd stop halfway through the session and then start sharing their feelings. And it ended up being, a talk session for, $30. And then I was thinking, what was it about this sound that was making these men feel safe enough for them to open up? And then when I started to explore sound and vibration, I came across a book by Dr. Mitchell L. Gaynor, who was a medical oncologist who was using the singing bowls to help reduce chemo for his cancer patients, and even to find the core issue of how that trauma may have caused the cancer in the first place. And then from that point on, I thought, hang on, there's a lot of, there's a medical practitioner using these singing bowls. And then when I started to explore, I was like, we're made up of sound. We're literally walking musical instruments. Everything's vibrating, and every single cell in our body is vibrating. Everything that you see is vibrating. And it's just in a place where it may look like a solid, but it's actually moving. And then when I started to look into that, I started to think, hang on, how does everyone not know about this? I mean, and a lot of the trauma is caused by sound. It might be someone that's yelled at someone and caused a trauma response. So, when I discovered that we can actually use sound to bring back those similar sounds and to unpack, these what may have caused it in the first place under an altered state of consciousness. It was able to really help people move from A to B. So,
and also just being able to simply regulate someone's nervous system can be key to then being able to move into a space where healing can actually happen for someone, or the clinical experience can be deeper.
and I
Just
think,
simple.
and you guys are aware of this, that nervous systems is key. I mean, everyone's nervous system is shot, basically. And I think COVID's really pushed it over the edge from what I'm seeing. We're aligned with the what is it, Queensland Alliance for Mental Health, and some of their reports that are coming out of mental health challenges. I think it's 1 in 4 are suffering in Queensland, but I even think it's more than that. I think mostly all of us have got some challenge that we're facing. And yeah, I think it's good that you guys are, learning counselling and helping people, and yeah, and I think what sound can do can really amplify what you do. Yeah.
Any tips, guys, on, let's say people are curious, maybe they don't feel like they're ready to jump into training, they just want to dabble, or they want to maybe just dabble with some clients, maybe have a couple of things on the table. Any tips just to get people in started?
Well, obviously, I think, getting a singing bowl or something like that, and just practicing yourself, and starting with yourself is probably the most important before you apply it to other clients. And just form a relationship with the bowl or the sound.
And you
And
can start with something really simple, a couple of smaller bowls is more than enough. And then notice playing on friends and family, noticing the response there, playing on either side of the head, gently, softly, and noticing. Yeah, is just the way that I would start. Definitely getting a couple of instruments.
So I guess people finding something that resonates with them. So for me, for example, I guess it was just coming across these things and then having a little experience with it and saying, oh, wow, that's really interesting.
Yes.
And then just having it on the table. So I guess like we're often used to having, let's say, more structured modalities where
Yes.
it sounds like, I think, when we're giving ourselves permission to just kind of explore, just to have a thing there. It doesn't even have to be a big therapeutic kind of focal point. It could just be, that you're in. So for me, it's often, you're interested in that. Have a little play with it.
Yeah.
What
Yeah.
comes up for you? What does that bring up? And maybe that leads to something, or maybe it doesn't. But I guess I'm introducing it in let's say, a more informal way, but it's more of a explorative kind of thing. It's just like a bit of an exploratory thing. And if it brings something up, great. If it doesn't, that's also fine. We move on with it.
I would
So
also say, like, attend if for those who've only done 1 or 2 here or there, go to a few more. Go to some sound bath experiences, listen for yourself, experience it more yourself and see how it feels, get feedback from clients. I really like what you said, Aaron, that you just have the instruments there, and if that's a really kind of responsible way of doing it as well. Of introducing the sound is just like, if you're curious, well, have a little strike. How do you feel? I think that's a really beautiful way that you're not suggesting that you're a qualified sound healer, but you're offering something for people to play is really, really nice.
experiential, yeah, exploratory,
Yeah,
but
yeah.
experiential kind of thing.
yeah, yeah,
Curiosity, yeah.
yeah.
Also, the great thing about this is you don't need to know how to play an instrument. It's just really striking it and hearing the sound. And these sounds are different than, say, for example, a guitar where you've got a sound and then it stops. These continue, these sounds that they go past your mind sort of wants it to finish, but it doesn't. So, and that sort of frees the mind into being structured into a
So
structured area.
think we're like talking about like inharmonic tone. So rather than there being melody or rhythm, that what happens is inharmonic tone creates just a movement of sound rather than something that's quite specific. And when you have rhythm and melody, what that activates is the thinking mind. Like from the perspective, it was what we're trying to really do is actually take people more into their body, into what they're sensing. So like I'm sure you will experience this when you listen to a song, it brings up feelings, emotions, or memories. So inharmonic tone is different. It's creating sound waves. And those sound waves then kind of act as like a little container or a soft place to land where everything can spread.
I call it a sonic cuddle.
Yeah. But if you start to use like melody, it can often make people think, right? Oh, this is a song about, oh, I remember that from this. And an inharmonic tone is the movement of sound waves, not imbalanced, obviously. So that's where like finding the right binaural beats to use and that's like a walking into the jungle because there's so much nonsense out there. So it's hard to find something that's actually accurate. Um, so
Also,
yeah.
these sounds are inaudible as well, so that they go within the range of hearing and out of the range of hearing as well. So it as Becc said, it can really be a somatic experience where you feel it in the body.
Yeah, I've
And
had people say that they feel formless. Um, like they become not so attached to any particular idea, thought, or part of the body. And I also did some sound up at Bear Cottage here in Sydney, which is a hospice for young dying children, which was very touching and moving. But there were children I did sound for that weren't able to hear, see, speak, eat. So they were on feeding tubes, but they felt the sound. It was just quite extraordinary. So I go up there occasionally and I'll do sound, and the children are lying on their beds or they're hooked up to various machines, but they could feel it. Yeah. So really, really special.
we've got about 5 minutes to go. Does anyone want to ask any more questions?
Yeah, I've got a bit of a question. Well, I've got a whole question. So you're using the bowls and whatever for the vibrations and the sound. Do you ever put both on the like put the bowl on the body somewhere? And is there a more prominent place to put it, like over the heart, whatever? Did that make sense?
Do you want me to chime in here, Leith?
Uh, yeah, I think so. But obviously, the training's important for
Yeah.
anything that's on the body.
Yeah.
And we'd love to sort of give you a quick overview of but really, it's important to run through, especially the sound therapy practitioner training, which is more one-on-one work when you're putting instruments on the body.
Yeah, because there are lots of contraindications, like anything that's metal that's in the body, anything that's running on electricity, so metal stents, pregnancy, and whether you're using it as a form of massage or whether you're using it, like which part of the body will depend as well. So wherever there's more skin tissue, the vibration will get sunk in. So so it's like a whole area, but start on the chest if it feels okay. Use stabilizers but it's a process. Like the body work component of sound is a real thing. Joints, muscles, ligaments, but then also the energetic side of it. So
So
there are specialist therapy bowls as well.
we've made the distinction in the association that sound healing or group sound work is for groups, and one-on-one is the therapeutical side. We've made those two distinctions,
But
and
it can be beautiful. So beautiful.
Yeah, it can feel amazing. Yeah, yeah.
What's your take on rain sticks? What's your take
Depend.
on rain sticks?
Rain sticks.
Yeah.
I have heaps of them.
We predominantly use rain sticks there for bringing people out of an altered state of consciousness.
Okay. Yeah.
Yeah, so we use these grounding tools for that process.
It's
Yeah.
not something that I would think that you would just kind of bring in a therapeutic environment and use. It's more often a part of a journey or I mean you could uh but I
We
think
use, we use them in soundscapes as well.
yeah, I use a lot of nature sounds, but usually it's more of a part of an experience, or when I'm bringing people back from quite a deep session, it's more of a clearing, a return, because the sound is very, very different to that of like vibration. It's not vibration, is it? It's the sound of nature. So it can bring people back after being somewhere quite deep.
I only use it if I've got one at home, and I only use it if I'm doing group work with a voice meditation over the top of the sound.
Oh, that's nice. Yeah, that makes sense.
Yeah, thank you.
Yeah.
I used to also go see a guy called Michael Trembath who passed away a few years ago. And he would use all these, he was an American psychologist, but also trained in Sambahan, which is a vibrational type of massage. But
Mm,
he would also use the tuning fork and then basically his hands and his voice. But
yes.
there was no conversation type therapy.
No.
Can I ask a question about when you're using your voices to communicate with your clients? Is there trainings that you do where you slow down the voice or raise the pitch or lower it, or is there a tonal work that you are involved in that is part of the studies? Just out of curiosity.
I think in general, for me, it's about the words you use, but slowing down the clients a lot as well, because they tend to talk really fast. But also not doing the injection thing at the end of a sentence that makes it sound like a question.
Yeah, yeah.
Yeah.
For me, it's about using my voice and using the room as a safe space. Yeah. Anybody else want to say anything?
No, you're right.
I think we all naturally kind of know to regulate our voice somewhat, especially if you've had a bit of, maybe MDR stuff or some gestalt or something, with a bit of body involvement. I think we all innately know it, but sometimes those trainings just will focus a bit more on, and then we're going to go a little bit deeper.
Yeah.
Just no alteration. I think it's an interesting point you're making, I guess, that your voice is sound, and to
Yes,
use that as a
absolutely.
tool as well. Yeah.
Absolutely.
Well,
Yes.
the voice is like a fingerprint. It tells you all the emotions that are in the body just from the sounds, the tone, the pitch. And there's a lot of research out that uses the voice to discover what emotions that are actually sitting in the body from their voice. Yeah.
I often ask the question to someone who's experiencing a trauma or a reflection, whose voice is telling you this, whose voice did it in your head? And a lot of people can reflect that that's my mother's voice or that's my father's voice when they've been dead for 1,000 years. So it's something that can be really helpful for a client because they've learned this thing about their life and about them from someone else's perspective, and we tend not to go in to challenge that.
Yeah.
Yep.
Yeah.
Yeah.
Yeah. That's really beautiful. Yeah.
Yeah. Well, yeah. I mean, I really appreciate you having us on and running this presentation. It's been really interesting and loved all your questions as well. It's really helped us to understand a little bit more about aligning with more professionals and seeing where we can amplify what you do and to sit in these areas and coexist.
I really feel like sound could be an incredibly powerful tool in a clinical environment. If I look back on my experience, it just because it can be sometimes feel like such an exchange. You walk in, you talk, you exchange, and then you pay the money and you leave. And sometimes, in my personal experience, it's felt like there's something missing. And this can really bridge that gap. I really feel, which is why I use it. I use sound rather than going and studying. After I did my diploma in community services, I did a year of psychology, and then I just said, no, I'm just going to use sound, because that was where I was seeing more results, really.
But
And
even to take a bit of the pressure off, as well, and to let the sound
do the work.
do some work as well. Yeah, I think that would be really helpful.
There's so much scope for it, guys.
Yeah.
In your position to be able to really, I just think it's a really powerful tool. If anyone's interested in it, should definitely explore, because people are asking for it. So,
Yeah,
Well, thank
awesome.
you.
Any other questions or comments?
No, it's wonderful, complementary to what we're doing.
yeah,
you.
absolutely.
Yeah.
Yeah, thanks very much,
Thank
guys.
you.
Yeah, please send through that other information, and if any slides or any of those the training deals or whatnot, please send it through to me, and I'll get it out to everyone.
All right.
Sounds great. Nice to meet you all.
Thank you. Thanks, everybody.
Email address.
Lovely to meet you.
We got the info. Yep. So we got the email address up there. They're just writing down the email, guys. But
If we get the slides, it'll be on.
yeah, they'll send me through everything. Yeah.
Yeah, great.
Thank you very
very much,
much.
guys.
Thank you
Thank
for
you.
your interest.
All the
All right.
Bye.
See you later.
best.
Bye.
Thanks.